Hello friends, I'm Dr. Aseem Goyal and I'm a bone and joint specialist in Prime Healthcare Clinic, Chandigarh. Today we are going to talk about a neglected but very important topic, that is psychosomatic disorders. Psychosomatic disorder is a psychological condition in which there is occurrence of physical symptoms which usually lack a medical explanation. People with this condition may have excessive thoughts, feelings or concerns about the symptoms which affect their ability to function well. These medically unexplained symptoms are closely related to stress and anxiety. A common misconception is that a psychosomatic disorder is imaginary or all in the head. But in contrast, psychosomatic symptoms are real and require treatment just like any other illness. Common physical signs of stress include digestive issues, dizziness or shaking, headaches, muscle aches and pains, racing heart, and an elevated blood pressure. The exact mechanism of stress are not completely understood, but here's an analogy that might help you explain it. Compare your body to a pressure cooker. If it is allowed to vent its steam, it works efficiently. If it can't release steam, the pressure continues to build until the lid blows off. Now imagine that the pressure cooker is already under pressure and you have to apply more pressure to keep the lid on. When the container can no longer hold in all the pressure, it will break at its weakest point. Like the pressure cooker giving away at its weakest point of its structure, stress-related illness is most likely to develop where the body is already weakened. So if you have a psychosomatic disorder, you might feel as if your doctor is not taking your symptoms seriously, thinks you're making them up, or believes they are all in the head. However, it is important for the doctor to understand the source of your symptoms in order to treat them effectively. When unable to find a clear physical cause for your pain, such as an injury or an infection, a smart doctor may ask you how you feel emotionally. The hope is that if a source of stress can be identified, it can be treated just as obviously as a physical injury or illness. So when a doctor asks about stress in your life, for it doesn't mean that they think your pain is not real. Physical symptoms caused by stress are very real, but they are caused by a different mechanism than say bone break. For treatment of psychosomatic illness, you may be referred to a mental health professional, but that doesn't mean your symptoms require only psychological treatment. Learning how to effectively manage stress is important, but it can take time. In the meantime, your doctor may treat your physical pain and other symptoms with medication. Another way of thinking of psychosomatic illness is a river that floods after a dam breaks. The most effective way to prevent a flooding is to fix the dam. However, the flooding that has already happened must be dealt with while the dam is being repaired. In dealing with psychosomatic illness and the physical effects of stress, learn to let go of what isn't serving you. First, accept that you are human and allow yourself some grace. Then do the difficult but necessary emotional work, such as allowing yourself to feel emotions that are hard to confront. Also, let go of expectations and old guilts, the shoulds that have been guiding your behavior. You might benefit from giving up control in some areas of your life or easing off your tendency to strive for perfection. Remind yourself that it's okay to fall short of your goals as long as you're trying and doing your best. And as you are identifying stress in your life, you may realize a big source is the pressure you put on yourself. And therefore, it is within your control to release it. I hope you find this video useful. Thank you.